So for that, I have to get out my Wayback Machine to 2009 so we can talk about all the reasons.
Hello, team, and welcome to Beerocracy. I'm your host, Emily Gross, and I'm very excited today because I have Jenny Sullivan with me, and she's the Director of Health Coverage Access at the Center on Budget and Policy Priorities. Jenny, thank you so much for being here with me.
Thanks for having me, Emily.
So for those who are unaware, we're currently in a government shutdown, and the big sticking point at the moment between the Democrats not signing on to a continuing resolution is because they want to confirm that there's a couple different things surrounding healthcare access. Two big things. One, giving back access to a lot of legal, emphasis on the word legal, non-citizens, but like residents and migrants that live in the U.S. that were cut out of the One Big Beautiful Bill Act, and also saying the Affordable Care Act subsidies that are set to expire at the end of the year. So we're going to be diving into all of this because there's so much misinformation going on and it's making me go crazy. Before we begin, what are we drinking?
Oh, right. Of course. I have to crack it open. I have a lime high noon.
Delicious. And I have something new from Trader Joe's, a giant hard tea. It's pumpkin chai. The person who's checking me out said it tastes really good, but I'm fearful that it's going to taste like crap.
So it's always a risk with pumpkin.
It's always a risk, but I chose it because they spell giant with a J. And I do feel like I'm living in a world where people would tell me, no, that's the correct way to spell giant. So, the misinformation that we're living in. But anyways, cheers.
Cheers.
Okay, that's actually delicious.
All right.
Wow. A pleasant surprise. So before we fully dive in, the question I always love to ask my guests is, why should we trust what you have to say?
So I have been working on health coverage policy since 2004, so over 20 years. I have been at think tanks. I have been in the federal government briefly. I led the policy effort at an operation designed to get people connected to Obamacare when it was new. I was a volunteer enrollment assister myself on my own time for about 5 years in Virginia. And right now I lead a project to sort of educate and help people who do enrollment assistance work follow all the twists and turns of what's changing these days. So that's a lot of experience.
And there are quite a few twists and turns. So as I was telling you before we started recording, I made a video talking about how the government shutdown was going to fuck up your day. And the comments were so significantly divided between people who... The comments are full of misinformation, primarily surrounding the Affordable Care Act and who qualifies. Can you walk us through the eligibility requirements for the Affordable Care Act?
We can talk about there are more of the requirements than just citizenship or immigration status. But since the law's inception, since it started enrolling people in 2013 for 2014 coverage, people who are not in the country legally are not eligible to get coverage. They can't pay full cost. They certainly can't get a government subsidy. They are not permitted to enroll in marketplace coverage. People who are in the country legally have to prove that they're in the country legally, and there are a lot of different categories. And as anybody who follows immigration policy knows, and you have to fulfill the requirements and submit a lot of documentation to prove that you, in fact, meet the requirements of being in the country legally before you can get any sort of assistance with your coverage.
Okay, people, you heard it here. And you're positive. There's no weird, funny business going on.
There's no funny business. In fact, what we see when these things happen and when these issues spike, as they are certainly spiking this year, what happens is that even fewer people who are eligible, who are in the country legally, are willing to enroll in this kind of coverage because they're scared. They don't want to get caught up in the wrong thing. And so there's this natural chilling effect, which we are certainly seeing. So the real detriment is that people who are eligible and who have very low incomes who need health care are missing out.
Yeah. So let's talk about some of these Affordable Care Act subsidies, because from what I understand, they were initiated to help people during COVID, so in 2021, and they're set to expire at the end of the year. And the Democrats are wanting confirmation that they will be continued. Can you walk us through what these subsidies are?
So the Affordable Care Act was designed again, back in the sort of 2010 era, there was always the idea that people needed coverage, and the thing that makes it hard for people to get coverage was pre-existing conditions at the time, and we took care of that in the Affordable Care Act. But also, it's just too darn expensive. So how can we make it more affordable for people, but preserve choice? Because what's really important to people when they're shopping for anything in this country, but certainly for health insurance, is choice. Don't stick me in one thing that one size does not fit all. So give me
We
some
love
options.
freedom.
Give me freedom. And so there are these premium tax credits, and they are designed, not everybody gets one, but if you have an income below a certain level, then you can qualify for one. But it's calculated. It's complicated. Would love to get into the details. It's where I live and breathe. But it's based on your income. So if my income is at 200% of the federal poverty level, then I'm going to pay a certain percentage of my income to get what we call a benchmark plan. It's kind of a middle of the road plan. But maybe I don't want a middle of the road plan. The way that the subsidy works is it says, you've got that amount you have to pay, and the difference between that amount and the benchmark plan, that's your subsidy. So you just take that, it's like a little voucher, and you take that and apply it to whatever plan you want, because choice is important. Maybe you want a plan that covers everything. Maybe you feel like you're pretty healthy, you want the lowest premium possible. And so you have that choice. 2021 comes along, and we have the opportunity to make that assistance more generous. So people can get a larger subsidy to shop for whatever they want on the marketplace. And that's what's at risk right now of expiring at the end of this year, unless Congress acts. And that's what's at the heart of this shutdown debate.
And what would be the impact be if these were to expire without being renewed?
Millions of people will lose their coverage. And why will they lose their coverage? It will be too expensive for many folks. And people will, and even for people who would keep some assistance, they're going to look at what it's going to cost them, and they're not going to be able to afford it. Or people are going to downsize and say, oh, I can't afford much, so I'm going to buy crappy coverage because I need something, but it's not going to pay for my medication. So they're going to pay more out of pocket for their actual health care as a result.
Yeah. No, I think I saw like a stat from Kaiser Family Foundation saying it was like premiums go up like 75% or like 114%. I mean, insane numbers.
Right. So we have this kind of confluence of two really nasty things happening right now. On the one hand, we have premiums, sort of the rates for next year that insurers set and say, this is how much I need to be paid. And that payment then gets split between the enrollee and the federal government if someone's getting a subsidy. Those amounts are through the roof. You know, the averages as of this summer, the first round of rate filing were around 18%, but that's middle of the road. And we are seeing much, much higher amounts in specific markets. And these prices vary widely from one state and one market to the next also. So you have that going on. And that is driven in part by all of this uncertainty, the things that were in the Republican mega bill this summer. That when insurers file their rates, they have to have a justification. And when it gets reviewed, they have to write, this is why we're increasing our rates. And we saw medical inflation, we saw higher prescription drug prices, and we saw a regulation that the administration finalized earlier this summer, as well as this new law as sort of justification for why insurers want more money for the people they're going to enroll. Because they think and they know that fewer people are going to enroll next year. These subsidies go away, plus there are new rules on the books that make it harder for people to enroll. And by making it harder for people to enroll, the people that will jump through all the hoops are the people who actually have healthcare needs that they know about, that they need to get care for in the coming year. The healthier folks that make the risk pool wider and make rates lower for everybody else, those are the folks that are going to run for the hills and say, no, this is not for me. Too much money. So
that's crazy. I have a question because, I mean, I've been very fortunate, one, to have been my parents' healthcare until I was 26, and that was through their employers. And then I have had health insurance through employers as well for my entire duration. But there was a couple of comments that mentioned like being kind of like in a middle, I'm going to just call it middle shit spot, where it's like you certainly don't have enough money to actually afford health insurance off the market. You don't actually make the lower amount in order to apply for the Affordable Care Act. What happens to those people?
So that's another really important thing that happened in 2021. We had these larger subsidies that went in place. But originally, the way the Affordable Care Act was structured, the subsidies stopped. There was a hard stop at 400% of the federal poverty level. What the enhancements also did is say, you know what, if you get to 400% of the federal poverty level and the cost of coverage for you is still going to be more than 8.5% of your income, that's not a small number. That's a chunk of change. then you can get some subsidy to help you out. Now, it's not going to cover everything, but it's going to give you a little bit of a discount. And that sort of smoothing of that cliff is what we saw as part of these enhancements, and that is also at risk. So we would return to a place where at 401% of the federal poverty level, you are on your own, no more assistance. Most people enrolled in the marketplace don't have income that high. So it's like a really important thing for a smaller group of people. Most of the people getting most of the help have very low incomes.
Right. And another big part that I also saw that was at the kind of at the center of why the Democrats are not. I feel like my language is sometimes putting a lot of blame onto Democrats for this. Incorrect. Okay. I believe everyone should have health care no matter what. Whoever you are, you should be able to get health care. And Republicans are the ones in charge of all areas of the government, right? So it is very much able and up to them to compromise. So just getting that out of the way. But I saw another part of this was because of rollbacks from the One Big Beautiful Bill Act, which they're trying to do a name change on that to make it seem they're like American Tax Credit Act. Bullshit. Don't let them fool you. Okay. Where they're trying Democrats want to make sure that people that are here legally, although they may be non-citizens or they're like refugees or asylum seekers, are able to apply for Medicaid again and able to qualify for Medicaid, because I know there was some big shift that happened. Could you provide more insight into that?
So we did see in the Republican mega bill this major rollback in health coverage for immigrants who are in the country legally, as you say, including asylum seekers and people here for humanitarian reasons. And across marketplace coverage, premium tax credits, Medicaid, Medicare even, we see this gradual rolling back so that the only people who are not U.S. citizens who would qualify for any of those programs, any of that assistance, would be legal permanent residents, those are green card holders, certain Cuban and Haitian entrants, and people from the COFA nations living in the United States, Compact of Free Association nations. So it is a radically smaller group, and as you say, it excludes people that historically, traditionally as a country, we have welcomed. Refugees, people here for humanitarian reasons, people victims of trafficking, human trafficking. These people would not qualify, will not, in fact, according to the current law, qualify for these programs in the future.
So what happens if one of these people, let's say the Democrats fail and are unable to get this back to be rolled out, right? So to include these people back in ability to get Medicaid. Let's say one of these people go to the emergency room with an emergency. What happens? What's the play-by-play?
So for that, I have to get out my Wayback Machine to 2009 so we can talk about all the reasons that the Affordable Care Act was the policy choice on the table back then. We are all in this together. We all go to the same hospitals. We go to the same health clinics. We're part of the same health systems. And the number of health systems is shrinking thanks to consolidation. And when people need care, they get care. We don't turn people away. We have not said at the ER, door, show me your papers. We stabilize people. We make sure that they get care for acute needs. And that care is not free. And so that care gets passed around, or the cost of that care gets spread around the people who are paying for care, whether they are getting, employer coverage or through Medicaid or Medicare. All of our rates go up when we allow some groups to be excluded because those groups don't stop needing health care, as you say. I believe it's a human right, and people who need care deserve to get care.
You would think it's not a radical thought, but based on the deep, dark depths of my social media comments page, it's quite a radical belief, which is kind of crazy. Because people are like, well, if you let everyone in, they can just go to the emergency room and then the federal government has to pay for it. But I feel like there's some misinformation with that. Could you clear that up?
Sure. So, the first thing is that when people come in, they have to be stabilized. We have this thing called EMTALA. People have to, if they present with an emergency, we say, yes, we should stabilize those folks and make sure that they get the care they need. They don't die because they have been in a car accident, for example. That doesn't mean that the person is enrolled in Medicaid all of a sudden, or, is going to pick up some marketplace coverage on their way out the door. And that person is not getting regular coverage for the things they need. Maybe they have asthma. Maybe they have another chronic condition. They're not getting that kind of care. The folks in this country who don't have access to stable health insurance patch things together. They mostly forego things, but they may be able to go to a community clinic to get some very basic things that they need. But it's not a great solution.
No. And there had been a lot of misinformation that Medicaid, federal funding for Medicaid was being given to people who are undocumented. But that's false, right? Isn't it state funding? So it's up to your state to decide whether or not they want to give those funds and provide those services?
So states, so Medicaid is a state-federal partnership. And so the feds put some money up and the states put some money up. But the feds will not allow money to be spent to cover people who are not in the country legally. Some states have decided they want to cover people regardless of their status. And when a state decides to do that, they use the money out of their own state revenue.
I'm like so hoping that the people who have all this misinformation listen to this podcast and like believe it. But there's just such vitriol and so much purposeful misinformation coming from the upper echelon of the Republican Party. And it's so frustrating. But like, this is real. Of course, some things do slip through the cracks. That's with fucking everything, right? But when it comes down to the fundamentals, the foundations of all of these programs, if you're worried about them going to people who are here undocumented, right? You shouldn't be. That's not who these programs are for. Do I think they should be? Absolutely. I think it should be for everyone who's here, right? But that's not who these programs are for. And the foundations of them are for everyone that is here with papers, who's here legally, and who are citizens and who are Americans, right? That is the foundation of this. And it makes me so angry that there's so much misinformation going around. It makes me feel cuckoo, absolutely cuckoo. I need like 20 more of these.
Well, and I mean, I think that it distracts, as is the way in 2025. It distracts from who is actually benefiting from these programs. Who's going to hurt if these enhancements go away? Small business owners. 1 in 4 marketplace enrollees is either a small business owner or self-employed. I talk to a lot of journalists who are freelancers who share at the end of the interview, I'm actually enrolled in Obamacare. The program helps a whole lot of young people because it's hard when you're just starting out, whether you're coming out of high school, coming out of college, finding a job that offers decent benefits. And that might not be a forever solution, but for a little while, you're getting off mom and dad's coverage and you're starting to establish your own professional life. It's hard to make ends meet. And 28% of marketplace enrollees in 2025 were between the ages of 18 and 34. This is a program that is helping a whole lot of young people. And then a whole lot of people at the end, people whose career is coming to an end or who are getting ready for retirement, but they're not quite eligible for Medicare yet. They haven't reached their 65th birthday. That's 23% of marketplace enrollees. So I think the immigration talking points, they're a sexy sort of side game, and that is not what's actually happening. The majority of the people are in this country legally. All of the marketplace enrollees are in this country legally, and the majority of them are U.S. citizens who are about to see hundreds and thousands of dollars in higher premiums for 2026 unless this gets fixed.
Right. And if, allowing the ACA to be, rolling back what the One Big Beautiful Act got rid of, right? It only impacts 1.2 million legal, right, immigrants. Okay. 1.2 million, which is like a minutia, like an absolute minutia compared to the actual population of the US, right? It's such I feel like people just need to be like a little bit more forgiving, a little bit more empathetic, and perhaps recognize the fact that you have no decision in where you were born, okay, and the life that you were born into. And maybe we should all remember that.
Well said.
Perchance.
Well said, Emily.
Mm-hmm. Is there anything else that you think is really important that we clear up about, the Affordable Care Act and also Medicaid and Medicare? I know those are very different, but like very different. Yeah, big wide. But
well, I think an important thing to mention is as Republicans are talking about, oh, we need a clean CR, we need a clean continuing resolution, Democrats just need to come to the table and get that done. Then we can talk about healthcare. It is October 2nd as we're having this conversation, and open enrollment for marketplace coverage for next year starts on November 1st. If we don't get this sorted out by November 1st, then when people go to that website and get ready to re-enroll for next year, they're going to go, holy, what? I cannot pay that much money for coverage. No, thank you. And even if something gets dealt with later in November or later in December, really close to the end of the year, we like these 11th hour decisions. That person's not like waiting around to see what Congress does and coming back in January to get in the door. And even if they do, you only have 2 weeks until open enrollment closes. It closes on January 15th of next year. And that, by the way, is getting shorter going forward. But this is the last year we have a little bit longer time. The other thing about all of this timing is that more than half of marketplace enrollees choose to just let it, like, set it and forget it. Let me click the button. I'm going to automatically renew. You just roll me over and I can, I'll make some adjustments if I need to in January, but just take care of it for me. I think it's fair to say a lot of Americans are not following this play-by-play, and they're going to continue to set it and forget it. And when they get their bill for their first premium in January, which will come right around the holidays, end of December, they're going to be even more shocked. They're going to have this major sticker shock and go, what? I can't afford that. And I have, a week to pay my bill before I lose coverage. What is going on? So I think the idea that we can just put this off. It's like saying, well, the house is on fire, but we can put the fire out in a few months. The damage will be worse if we wait a few more months. So while that may technically be true, this has some real urgency behind it.
Yeah, absolutely. And from what I understand, these subsidies, I think how much are these subsidies estimated to cost if they were to be renewed?
Oh, the renewal estimate is, I want to say, in the $350 billion ballpark.
Okay,
it is for far less than we decided to pay for the tax cuts that were in the Republican,
which I think was around $4 trillion over the next 10 years. If that rings a bell. Yeah. Okay. I feel pretty good about this conversation and helping people put things in perspective. Yeah. Well, Jenny, it's been lovely to have you. Thank you. It's such a needed conversation. That's such a hot topic, and people forget, in their anti-immigrant rhetoric, forget that the ones that are actually being hurt the most are the poorest and most vulnerable American citizens, right? That are all over the country, especially those that are in a lot of red areas, right? And it's very important that people clear out all the noise coming to them and recognize the importance of this, and that is providing people with healthcare.
Yeah, and absolutely.
Foundation always is, right? Whether or not I agree with it or not. Federal healthcare programs are only for legal residents. That's it. There's no ifs, ands, or buts. So, Jenny, thank you. Thank you for helping me clear things out.
Absolutely. My pleasure, Emily. Thank you.
And I'm your host, Emily Gross. We'll be back next week with another episode of Bureaucracy.